the most exciting thing is probably how AI will affect healthcare. It's very new, and we see how AI has worked in the banking industry, and we no longer go to a bank anymore. We just go on our apps. And nowadays, with what's happening with healthcare and wearables and apps, and it's completely changing how healthcare will be delivered, and it'll affect how we design hospitals in the future.
It's really going to facilitate our working experience so that we are much more efficient. And hopefully in that efficiency, we open up space for empathy. That's really what designing an experience is about, is how do we create that opportunity for human connection and empathy? And hopefully this new technology opens up that space. I like to think that because we're now going to be having devices that really kind of link us, in a sense, back to our caregiver, that they know us more fully. Wouldn't it be nice that my whole life story, in a sense, becomes part of my medical record? And that because of that, those kind of clinical decisions are broader and maybe have a greater impact, that my clinical team knows me more. As data becomes ubiquitous, one, it's invisible, but does it become part of the building that lets the building itself be empathetic? And what does that mean? That means that my device might connect with my room. It knows that I might have some anxiety. And so is it going to transform that room? Part of feeling at ease is being familiar with the space. And so can a room, in a sense, adjust to who I am, where I'm from? One of the examples that I like to talk about is just lighting. I'm from Chicago. The color of light, the light temperature in Chicago is much different than, say, Florida. So because my story is part of my record, does the room know that I'm going to feel more comfortable in this light temperature, this light color? So those are the things that I think really can have an impact on how we design, how we think as designers, and how we create that much better, broader experience.
I think AI, I think some of the quantum computing and things like that are coming towards are really rapidly infusing into our clinical environments are going to make leaps and bounds a huge advancement in the way that we do our work. It won't replace us. It'll definitely make our work easier to do. The idea is that it'll deliver a certain amount of information that will make us more efficient in coming up to the challenges and solutions that each patient faces. That clinical decision-making is something that can really impact the outcome of patients, the outcome of a facility, the outcome of a disease. And so we want to make sure that we find the right way to use these technologies to make our work easier to do.
AI is an increasingly important part of the healthcare experience, but it really can't replace that human connection. So we look to things like AI to help with documentation, to provide additional education, to advance our scheduling. All of this allows our clinicians to have more time with the patients and their families, which is our ultimate goal. We don't want to replace that connection, we want to augment it. Our designs really need to accommodate those kind of both in-person and virtual technologies. So whether that's lighting and acoustics, the colors that we choose in those spaces, all of those are things that we need to think about as we think about not only the patient experience there in person, but the patient experience on the virtual side of things. But ultimately, children are incredibly tactile. They take on increasingly more sensory environments. And so we need to consider that as the ultimate experience in this space and ensure that our technology and our digital experience does not interfere with that experience and that our patients truly can embody space that they're in.